Good afternoon, everyone. Can everyone hear me? Just give a thumbs up. I just wanted to say welcome to our annual call to action for Northern and Southern California chapter of HIMSS. This is our what we have called in the past our state HIT day. Today we're calling it our call to action. We have our friends from Washington with us today, Jeff Coughlin, Alana Lurer. They're going to talk to us about what's going on the national level, as well as what's going on specifically in telehealth legislation. And then we're going to hear from Ian Slade in California and look at what's going on in the California landscape. Then we're going to do some breakout sessions today and look at our, you'll have an option to look at our virtual campaign platform that we've put together. We'll be doing a virtual campaign again this year to support 3 bills that are on the legislative slate for California. More on telehealth discussions with Mai Kwong and Larry Ozerin. And looking again, any questions you might have on the legislative landscape and what's going on at the national level. So based on that, welcome everyone. I'm going to kick it off and turn it over to Jeff Coughlin.
Thanks very much, Nancy. Actually, Alana Lear is going to start the presentation, but Alana, just let me know when you want me to advance the slides.
Thanks, Jeff. Hi, everyone, and thank you to the Northern and Southern California chapters for having us here. Again, I'm Alana Lear, Manager of Government Relations at HIMSS. And so next slide. I will start off by sharing our 3 major public policy priorities that we have at HIMSS. They are broadly interoperability, connected health, which includes telehealth, remote patient monitoring, and broadband, and finally, cybersecurity and data privacy. And clearly, we have a lot of buckets underneath those 3, but those are the 3 major issues we think about day to day. Next slide. And so this is one of the first part of our presentation is on how telehealth policies have been made temporary during COVID and how we can make them permanent in our strategies. Next slide. So as a background, in the face of COVID, temporary waivers were made at the federal and state levels to expand telehealth and remote monitoring, but they were made on a temporary basis. For example, CMS relaxed requirements for telehealth, governors relaxed requirements through executive orders. So it was a whole uphaul of telehealth. And we all know virtual care has been a lifeline during the pandemic for patients, for us all as patients, and also allowed service to continue for health systems. Most changes are still temporary at federal and state level. But there are changes that have been made permanent. Very few changes, but at the federal level, under Medicare, remote patient monitoring is available now for treating both chronic and acute conditions, including COVID-19, and that's been made permanent due to a change because of COVID. And at the state level, a few states have made telehealth changes permanent under Medicaid and private payers. So the questions everyone's asking right now is the big question: will more of these changes be made permanent? More significant changes? So that's what we continue to advocate day in and day out for that. So the next slide. There's been 2 acts at the federal level or plans to enable more service for telehealth. The first is the Connect for Health Act of 2021. At the end of April, leaders from the Senate Telehealth Working Group and the Congressional Telehealth Caucus introduced this act. It's called the Creating Opportunities Now for Necessary and Effective Care Technologies, or Connect for Health Act of 2021. And this would make significant progress toward permanently expanding telehealth for Medicare. It's bipartisan and bicameral legislation, and it was first introduced in 2016. So we've seen it gone through numerous updates over the years, and this will be crucial in advancing telehealth permanence in Medicare. Next slide. As for the American Rescue Plan, President Biden signed this into law on March 11th, and it is a significantly large plan, but part of it includes provides $500 million through the U.S. Department of Agriculture to award grants to eligible entities. And these grants could be used to cover COVID-related expenses and increase capacity and telehealth capabilities. So of that, those funds, $50 million can be used for mental health professionals utilizing telehealth services. So that will go to state, local, tribal, territorial governments, and other relevant organizations to fund that care. Next slide. So at the state level, we are tracking temporary policies and now permanent policies due to COVID. And there are three major buckets where state policies fall into. The first is licensure requirements and renewal waivers, where states have largely removed or reduced restrictions on practicing across state borders and expedited licensing process to deliver telehealth for providers to get licensed. The second is Medicaid, where Medicaid expanded coverage of telehealth. And the third is where private plans expanded coverage of telehealth at the state level. So those are the temporary policies that have been made. And now if we look at some permanent policies at the next slide, these are just a few examples of states beginning to make these telehealth policies permanent since COVID started. I want to highlight California. One bill that went into effect in January of this year, AB Assembly Bill 744, which relaxes requirements around telehealth and remote monitoring. And then Assembly Bill 32 was proposed, so it's still in the legislature, and it maintains pay parity through Medicaid, and it proposes to create interdisciplinary advisory group to evaluate telehealth. So you can see a few other states have passed or are considering passing permanent policies around telehealth. They may include removing restrictions on location of patient during telehealth, or for certain areas, healthcare specialty areas, or pay parity in some states. So next slide. So this is a big policy opportunity, and I'll talk about later how timing really matters to take advantage of this seismic shift in telehealth and how we see telehealth. So we are focusing on advocacy around this, and there's many policy opportunities, for example, to remove outdated and arbitrary restrictions that hinder telehealth adoption, to reimagine how telehealth can be most safely and effectively integrated into care delivery, shift focus to value, focus on the value of telehealth to policymakers, and designing a regulatory framework that promotes and incentivizes technology innovation rather than obstructs. And finally, future-proof policies for the next big innovation and for the next big public health emergency that we will certainly face in the future. We need to be more prepared. Next slide. So to finish off this section, I want to share a few resources that will be made available to you after, and this is on our HIMSS.org website, and you can contact me with any questions. Thank you. I will pass it on to Jeff Coughlin.
Thanks, Alana.
Yeah. Thank you, Alana. So I'm going to run through some of the other policy areas where we're focused very quickly. I know the focus of the Northern and Southern California chapters is on telehealth right now, and I think Alana's presentation really speaks to the importance of telehealth to our broader HIMSS advocacy goals as well. But there are other issues that we're working on. So I want to quickly just run through some of the other areas that we're focused. So COVID-19 is one of those areas that we have been working for the past several months on. We collaborated with 11 other organizations to develop recommendations that we sent to the Biden administration back in February that were focused on how we can maximize the use of health IT in any sort of vaccination or response effort. And that's geared towards vaccination distribution and administration. So some of the things that we talked about was about capitalizing on health IT and data system to support a federally coordinated comprehensive COVID-19 vaccination plan, also adopting an all hands on deck approach. And what we meant by that was really focused on making sure that all different providers, all different potential sites of care were being leveraged in vaccine distribution. And also the importance of interoperability. That's obviously one of our themes overall, and how we kind of look at our advocacy efforts. And then I would say the support for a public health campaign to make sure that we're democratizing data and information through digital solutions. That would kind of speak to maybe some of the vaccine hesitancy that's out there now, et cetera. And those are some of the big issues that we really tried to hit home in our comment letter. I would say the other issue is around digital vaccination credentials. And on this slide, we do have a little more information about where things are headed. This is obviously has turned into a thorny political issue. And I would say that on the left-hand side of the screen, you can see that the Biden administration in official statements has really emphasized that they're not going to push for any sort of mandatory vaccination credential or a federal vaccine database. So they don't want to be put in a position where they appear to be mandating vaccines. And what the administration has said that they're going to do is provide guidance about privacy, security, and any sort of discrimination aspects that could come out as a result of being vaccinated or not being vaccinated, depending. But there are several policy questions that I think need to be addressed. It's being addressed at the state level. It's being addressed by different collaborations across the healthcare ecosystem about who issues the credentials, who serves as the source of truth. About the importance of a single standard if we're ever going to get to some sort of broad-based acceptance around vaccination credentials in a digital sense, single standards or at least a small number of standards, making sure that we are all coalescing around that is going to be a helpful issue. So we can talk more about this during the breakout session, but I did just want to highlight kind of where we're at. And I think that I will just say that this issue took on an increased level of importance for us at HIMSS, given the announcement earlier this week that we made about the requirement for HIMSS Global Conference in August, requiring vaccination on the part of attendees and staff and other folks that will be there. So definitely more to come on these issues. So Alana already talked a little bit about the American Rescue Plan, so I will not talk too much about it, but I'll just say that it was a huge momentous task to pass this bill, and it included money for states, localities, and tribes that was really focused on trying to address the pandemic's economic impact. There was also money in there for evidence-based national testing strategy, and also a significant amount of money, $7.6+ billion to state, local, and territorial health departments. So there are a lot of steps there that are still in the process of being rolled out, but it's still a very big set of consequential actions that serve to help our economy and help us recover from the COVID pandemic. So I did just want to highlight really quickly, we do have new folks in the Biden administration that are kind of leading our broader healthcare efforts. So Mickey Trapati is the new National Coordinator for Health IT. He's been in the job since January 20th. And he's identified several priorities for his work at ONC. So I would say that one of the things that he has been focused on is making sure that health equity is prioritized, that health equity is built into health IT programs by design moving forward. Also, the interoperability information blocking provisions. I did not include any sort of information about interoperability information blocking in this deck, but that's obviously still front and center for us, still front and center for the Biden administration, and especially for ONC. So several issues that Mickey has identified in his role as national coordinator that I think are, very much priorities for us as well at HIMSS. So I will say that maternal health is one of these issues that fits into our broader equity agenda. So we are very supportive of what is called the Momnibus, which is the Black Maternal Health Momnibus Act of 2021. That includes 12 different bills that try to comprehensively address the drivers of the maternal health crisis that we're facing in this country. We're coming at this from several different angles, from a HIMSS perspective, from our Global Health Equity Network, and as well as a global maternal health challenge that we have underway. So we did sponsor a couple of events back in March, and again, happy to talk more about some of the results of that, some of the real positive steps that these bills collectively are making to try to address maternal health issues that we're facing. So in terms of must address issues for 2021, obviously front and center continues to be the COVID-19 response. We've already talked about kind of connected health, and Alana spoke about the permanence of any sort of public health emergency related changes to telehealth. One of the things that we haven't mentioned is broader action around data privacy and digital competition that would likely have to come from the US Congress. And that would be kind of intersecting the HIPAA privacy law, broader privacy laws related to just data protections more generally, how those overlap at the federal level, how they connect to federal and state law overlaps are definitely things that are high on many folks in Washington's agendas. And it's something that we want to be involved in from a HIMSS perspective. Two other things that I'll just mention really quickly is value-based care. We do think that is going to continue to be a focus for the Biden administration. The new director of the Center for Medicare and Medicaid Innovation, Liz Fowler, has been a big supporter of value-based care over her tenure in Washington. And the new soon-to-be confirmed administrator at the Centers for Medicare and Medicaid Services, Chiquita Brooks-LaSure, has also been a big supporter of value-based care. And then obviously the equity issues that we kind of already touched on. And we kind of include social determinants of health, as well as broadband subsidies and also net neutrality, along with maternal mortality, when we're talking about broader equity issues. So I did just want to highlight really quickly that we do have an event coming up on June 2nd related to how the interoperability regulations support a move to a learning healthcare system. So this is a June 2nd webinar. It's through our HIMSS Learning Center website. You can sign up right there with the link at the bottom, but we have a great lineup of speakers that I just wanted to make sure that we highlighted to you all. So I am going to stop there and turn it back to Nancy and Ian and actually Alana. So thank you very much.
Thank you, Jeff. I think we're going to save questions for your breakout session as well. Alana.
Great, thank you. So I'd like to present a very quick overview of advocacy and why it's important to advocate mostly at the state level, but also at the federal level in gearing up for your virtual march that launches today. Next slide, please. So to make a real impact at the public policy level, health advocacy is vital, and it requires all of you as constituents, as Californians, to participate and it requires a strong, respected, and coordinated voice. HIMSS chapters, and we work closely with HIMSS chapters, connect with and educate policymakers at the state, provincial, and local levels to amplify public policy priorities, research the issues, build coalitions, and monitor legislation. And when advocacy is successful, it has the power to guide strategic roadmaps, enact legislation, secure funding for policies, and share stories, data, information, and policy positions. So we really want chapters to see themselves as thought leaders in health IT. You are the experts being in the field, and legislators and other state officials really do want to hear from you. Next slide. So here's a very brief recipe for success for advocacy. It revolves around timing, relationships and teamwork and collaborations, data and stories. So first, for timing, like I said before, with COVID as a public health national or global pandemic emergency, we found opportunities for policy and advocacy around telehealth and other issues that were amplified, such as health equity issues. So it's really important to take advantage of certain bills that come up and continue to monitor legislation and policy work that the state is focusing on. Number two is relationships, teamwork, and collaborations. It's very important. We always emphasize to maintain relationships with state, local officials, including legislative staff, to make sure you're networking and keeping tabs on what is happening in the sector. Also, advocacy is a team sport, just like many other things, and it requires a lot of players. So we encourage you all as members to get involved with your chapter. And collaborations, chapters can engage with other organizations to really make a bigger impact and have a stronger voice. Data and stories go hand in hand. So we emphasize that sharing data, like a statistic about how telehealth has improved care delivery, combined with a story of your own personal or professional story on how telehealth has improved your well-being or healthcare during this pandemic, is really important to include. Next slide. These are some reflections from the field. Ian Slade, as you all know well, from Southern California chapter, he is greatly involved in advocacy, and he says that advocacy is an action word. Just start doing it and learn along the way. So it's really much like anything else. You learn along the way, and you can do, get your feet wet with smaller things like participating in our virtual march today, or reaching out to your chapter to see how you can get involved. And Christopher Cooney from the Georgia chapter says that anyone can become an advocate if they're passionate about modernizing our industry and using their voice for change. So we really believe that anyone who's a HIMSS member can become an advocate and encourage others to advocate on behalf of HIMSS and the chapter. So reach out to your chapter to get involved in advocacy. Next slide. So this is my last slide for now, but it introduces the virtual march that your chapters have created. This allows you to write to your California state legislators on the value of expanding telehealth in the state. It only takes 1 minute or less to participate. You can send a letter as written. It is ready to send, or add in a story on how telehealth has changed your personal or professional lives, as we all know it has, especially with COVID. So feel free to add in a story. Legislators love to hear those, and you may use the QR code here. Just use your phone's camera to scan the QR code and it'll pop right up. Or we can also put the link in the chat. So I think that's my last slide. So thank you so much, and thanks for listening.
Thanks, Alana. We're going to turn it over to Ian.
Let me go through how we can help make telehealth more permanent in the state of California. The first thing I want to say is access to healthcare should not require a state of emergency. As you all know, we've been pushing for telehealth for quite a long time. And for all the bad things that COVID has done, one good thing it has provided all of us is that it pushed forward telehealth for everyone since, well, meeting in person wasn't an option. All right. So just want to get everyone on the same page. In terms of telehealth, there are three types that we can look at. One is the synchronous, where you're doing the actual meeting like we're doing right now. You know, see Jeff nodding his head in real time, so synchronous. Asynchronous is when we either store it, we use patient portals, or the third type is remote patient monitoring, where we usually have wearables or we're reporting out patients' measurements to the providers, and they can take a look at it at their leisure. So these are the three, big broad buckets, if you will, for telehealth. And if you look at the evolution pre-COVID, telehealth was more of a nice to have, right? We still prefer to meet in person, but it's something that if we can do it remotely, it was kind of like, okay, if you can't meet, then let's do it via telehealth. And then we moved into the first 3 to 4 weeks, and we said, all right, well, it seems that we need to do this as a temporary band-aid for the situation. But as time went along, we come to realize that, oh, wait, this is something that we can actually do more as a permanent fix. And actually, there are some benefits to this instead of a temporary band-aid to the situation. Now, here's the cool thing. Of the folks that have tried telehealth, based on the Harris poll, 80% are willing to move forward with this. And it was a surprise, because one of the reasons why telehealth wasn't adopted early on wasn't just on a provider side, but also from a patient side. They preferred to meet in person. But the convenience of meeting virtually has tilted the scales, and now we have 80% of folks who've tried it out wanting to do it either for themselves or their loved ones. So when we look at legislative changes and policy changes, different areas that we need to look at. One is populations, right? We need to expand it to more people, more services. We also need to expand the technologies, making sure that the technology is available to both the patients and providers. For everyone here on the call, it might be hard to think about people without access to laptops, mobile phones, but in a lot of areas, both rural and urban, there are a lot of folks who don't have access to the technology needed for telehealth. Another thing that we need to look at are services and payment rates, right? So the insurance companies are still trying to adjust, catch up, and figure out how they can make this, a viable permanent solution. And obviously for providers, they're also trying to figure out, okay, what else can we move into this new space permanently? So populations, technology, services, payments, and providers are all trying to figure this out and move the needle more towards the right. So in terms of adoption outcomes, we can break it out into immediate benefits and also long-term benefits. For the physician, obviously, there are some immediate benefits in terms of flexibility and some long-term benefits in terms of decreasing costs. For the patient, same thing, flexibility, and also being able to go in and out, check in and out virtually quicker, and you can change your appointments faster. I used to work at a cancer center, two different cancer centers, And one of the reasons for non-compliance to patients' appointments was actually having someone pick them up and bring them to their consultation. So a huge part of that non-compliance is taking care of the fact that we can now do telehealth for a lot of the visits. Obviously, in the long term, this is more cost efficient, both for the patient and the caretaker. In terms of impact in the industry, we still have to look at different coverages, legal policies, especially when you're looking at, crossing state boundaries, right? And in terms of long-term benefits, we can look more on the preventative side of care and figure out how we can reduce the overall cost. I was reading the other day that we're now tiptoeing closer to 20% of the GDP. We're now, I believe, at 17. So that's a really scary number. So anything we can do to bring that number down would be, much welcome. All right. Although we have a lot of folks willing to continue with telehealth, not everyone is on board, right? Same thing as with the vaccination, not everyone's on board. So we still have some work to do there. Same thing with insurance coverage, not everyone is covered and not all treatment options are covered. And also we still have a lot to do in terms of technology and actually language. We still need to do more in terms of covering all of the different languages and dialects that are spoken, within the United States. So a lot more to do there. And I would like to quote our own state assembly member, Cecilia Curry, when she said, telehealth overcomes barriers to healthcare access by using technology to connect patients to their doctors, no matter where they live, what the demands of their jobs are, or what mobility challenges they may have. And we're lucky that Cecilia has been a champion and a partner for us. So I'm really happy that we get a chance to work with her. And for those who don't know, she actually won the state legislator of the year. I believe was it 2019, Alana, or last year? Can't remember the year, but pretty recent. So
It was 2019.
2019. Okay, thanks, Dr. Osborne. All right. So she is actually the author, I didn't know how to say that, of AB 32, and Alana mentioned it a little bit. And the goal of that is to expand both people being covered, services being offered, and also the timeline and providing expertise to look at how we can improve telehealth within the state. And I believe this is my last slide. So telehealth is the new normal. There is no turning back. Three things that we need to look at. Number one, recognition that telehealth can in fact replace a lot of the in-person visits. Regulation, we need to have better state-by-state regulation. Hopefully we can move towards a lot of standardization in this space. And lastly, reimbursement, making sure that this is a viable business model for everyone involved. So if we can move the needle in these three areas, that will help us make telehealth more of a permanent solution for the state of California, as well as other states as well. So that was it. Hope I did 10 minutes. Any questions? All right, giving it back to you, Alana. Thank you.
Thank you, Ian. Great job. This is it. We're the last folks on here. Thank you, Jeff and Alana, as always. You knocked it out of the park today, along with Ian. I thought he did a fabulous job. I know he had to jump, and I'm excited about the campaign. I think it's a good one. We just got some good feedback on the platform, and we recorded the session. We're going to send it out and see how much participation we can get. I just wanted to thank everyone for joining us today and remind everyone to join our virtual March campaign at campaign 33-198. And if you haven't seen it, the link is in the chat. You can see it now. And this is what the campaign looks like. And you can, the letter is pre-drafted for you, but it does come up in an editor and it allows you to add your own story, make changes to the letter. It will go to your representatives up here based on your full address and zip code that you enter when you go to the site. Go follow the link. So the link is in the chat today, and you will also be receiving the link to the campaign in a post-event email. So based on that, I just wanted to thank everyone for joining us today, and feel free to email or send in any questions or follow-up that you might have. And that's it. Northern and
Thanks,
Southern.
everyone. Thanks, Jeff. Thanks, Lana.
Thanks,
Thank you
Thank you
everybody.
all.
very much.
Bye all.
Have a
Bye.
great